initially, I'm going to assess a patient. His name is Gigi. He appears to his age, 50 years old. He has a good posture, and the skin looks pink, and he has a happy mood. He has no physical deformities, no problem with the gait, relaxed facial expression, and he is well nourished. Denies any hearing or speech problem, and a good personal hygiene. He weighs 185 pounds, and he's 5'9". He's a 5'9" tall. Now I'm going to assess your vision. Close the left eye and start to read the last.
H, K, G, B, C, A, N, O, M, P, V, E, S, R.
Close the right eye.
H, K, G, B, O, A, N, O, M, K, V, G, B, R.
I assess his pulse, temperature, and blood pressure was within normal limits. I'm going to assess your pain now. From 0 to no pain, 10 is the worst one. What is the pain level?
0.
Okay, I'm going to start physical assessment of head and neck. First, I'm going to inspect the scalp, cranium, and hair for any lesions or breaks on both sides. Next, I'm going to look at the facial expression and see if it's symmetrical, what's responsible for cranial nerve 7. Next, I'm going to palpate temporary artery, then mandibular joint, and ask open mouth and the close. One more time. Do you have any discomfort?
No.
Next, I'm going to palpate the maxillary sinus. Do you have any pain, tenderness?
No.
Next, I'm going to palpate frontal sinus. Is there any pain?
No.
Next, I'm going to inspect the neck for the symmetry, lumps, and pulsation. Next, I'm going to palpate the nose. I'm going to start with the preocular nodes, then postocular, then occipital. Next nodes I'm going to palpate is the submental, then submandibular, then jugular digastric. Next I'm going to palpate supracervical nodes, then deep cervical. Next I'm going to palpate posterior cervical nodes, don't feel any tenderness, then subclavicular nodes. Next we're going to palpate carotid pulse. If it's indicated for the patient, we're also going to listen to the breathing. Next we're going to palpate the trachea, make sure it's to the midline. Next I'm going to check for the range of motion. I'm going to ask you to tune your head left, right, and the up and down, and the shoulders up and down. One more time. Next I'm going to check cranial nerve 11, press against my hand, press against my other hand. Assess thyroid gland. I'm going to ask patient to sit straight and move head slightly forward, then to the right. It's relax muscles of the right side. And I'm going to ask you to swallow. Thyroid gland moves up. And I'm going to use one hand to move the thyroid to the right and the palpate between thyroid and muscles. No lump noted, and the same way to other side. No lump noted, and one more time other side. No lump or swelling noted, and normal size you don't see any swelling and don't feel a thyroid. I'm going to start assessment of the eyes, ears, nose, and throat. I'm going to start to assessing visual field. One side, now other side. Now I'm going to assess corneal reflex as both eyes both eyes on the same position. Next, I'm going to assess sixth position of the gas. So I'm going to move my pen to the sixth position. I'm going to start 1, 2, 3, 4, 5, 6. Now I'm going to assess external structure. First, I'm going to assess conjunctiva, sclera, iris, and the pupils. Next, I'm going to assess the pupils, they even, round, and I'm going to assess accommodation. Just follow this one. So accommodation is normal. Now I'm going to assess the red reflex, ocular fundus, general background, and macular on both eyes. Now I'm going to assess external iris position, alignment, and the skin condition. No breakdown on any ones I see. Now I'm going to assess auditory canal, tympanic membrane looks pearl, no drainage, no serum, everything looks good. I'm going to check other ear. Same, tympanic membrane pearl, no drainage, and I don't see any breakdown or any other abnormalities. Next test is going to be voice test. I'm going to ask you to close this ear, and I'm going to whisper the words, and you repeat it for me. Apple.
Apple.
Green.
Green. Red.
I'm going to ask you to close the other ear. Repeat the words for me. Apple.
Apple. Green.
Red. Next test is going to be Weber test. I'm going to just put it in your head. You're going to raise your arm when you start to hear that. Next, I'm going to perform a Zeriner test. I'm going to be close to the mastoid process, to the ear. Same to other side. And to the ear. Next, I'm going to examine external nose. I look for the symmetry. And next, I'm going to check nasal patency. Close one side, and close other side. Next, I'm going to examine internal mucosa with the otoscope. Okay, it looks pink, no drainage. Don't see any skin breakdown. Same to the other side. Looks pink, no drainage, no skin breakdown. Now I'm going to examine the floor of the mouth, internal mucosa, and tongue. Everything looks pink and moist. Next, I'm going to check for tonsils, and I'm going to number them. Tonsils about looks 1 to 2 points. No redness and swelling. Now I'm going to check for cranial nerve 9 and tail mobility. Open your mouth and say R. And I'm going to check for your movement. Looks good and patent. Next I'm going to check for your gut reflex. Last I'm going to assess internal structure of the mouth. So I'm going to check inside on both sides. Last thing I'm going to assess at the cranial nerve 12. I'm going to ask you to open your mouth and stick your tongue. Okay, and it looks patent. We're going to do the chest assessment. First we're going to see respiration, if it's even, symmetry, skin tone. Now I'm going to do tactile frequencies. You have to say 99.
99, 99, 99, 99.
I can feel good vibration. Now I'm going to do palpation. I'm going to palpate for any lumps, tenderness, any tenderness.
No.
Next I'm going to do percussion. Feel for any dullness. I don't see any abnormal findings. Next, I'm going to auscultate lung fills. You breathe normally. Next, I'm going to assess upper extremities, straighten your palm up and down, left, right, hands up, down, behind the head, and return to. Next, I palpate for epitrochlear nodes on both sides. Next, I'm going to inspect posterior chest for the configuration, skin, symmetry of the respiration,